So my current role, I am a Band 7 clinical lead physiotherapist.
We do admission avoidance, we do early supported discharge, so that's when patients come home from hospital. We do self-referrals as well. So.
And just the daily activities of washing and dressing, toileting, things that we all take for granted, when that's difficult for patients, that's where we step in. And so the little things, whether it be just providing exercises or that equipment, can make such a big difference to these patients' lives.
I've certainly seen a huge increase in palliative care referrals and end-of-life referrals, and the role that therapy plays within...
Oh, it's such an honour to be involved.
Yeah.
If somebody lets you in at the end of their life, it's such an honour.
I'm less clinical, and I kind of oversee the therapy services in the north of the county, so that's providing sort of mentoring and support for the staff, looking at the referrals coming in, looking at better ways to kind of do things and deliver the care, making sure that we're providing quality care, and that obviously we're moving patients through the system in a timely manner, so it's an incredibly busy but incredibly rewarding role.
So believe it or not, I spent 15 years as an electrician first, so I came in as a mature student, but there was a lot of transferable skills that I could use to get into physiotherapy, and then I got my Band 5 role on the ward at Bridgnorth Hospital. And that opened up the gates for me, for my career progression. My career's gone fast, I've progressed fast as well, but it's only because of the team and the support I've had around me that's allowed me to make that progression to where I am now.
I started life as a lorry driver and I used to drive monster trucks all over the country. So I retrained via an access course as a mature student. I originally wanted to be a physio because I didn't know anything about OT. I got first-hand knowledge of how people live and the challenges they face.
I think one thing that definitely shines through for everyone I've met working in Shropshire is the care. Everybody cares.
So I had a very similar journey to you, Kim, in terms of my journey to be an occupational therapist. I started in social services in care. I left Start and then I went to work at Princess Royal in Telford as a therapy assistant, and I was really fortunate there that they offered me a secondment to go and actually do my OT degree at university. So it was a 2-day release. I worked 3 days and went to university for 2 days. Like you, Chris, I progressed quite quickly.
It's never too late for someone if they want to change
absolutely
career.
not. I did a community role here. I then managed to secure the rehab coordinator role up. The trust allowed me to go on a leadership and management course, which really helped me. I'm very much about promoting support workers, but I've also then managed to secure 2 other support workers to go through their apprenticeships at Coventry doing occupational therapy.
I think we can provide lots of support because we've been in that role ourselves. You know, there's that many ways of getting into physio occupational therapy in the community now. We have students on placement.
Yeah.
You know, the diversity of the opportunities that they can have, whether it be, you know, on the ward in a community hospital, getting open to working in acute environments.
Now we're also offering our rotations, aren't we? That's
Well,
the good thing about community, isn't it? Because you actually see such a diverse clientele.
Yes, and it's heightened my skill set. I'm continuing to learn. Shropshire have been very supportive with my progression and courses that are available.
I was asked to go around the county and taught all of the therapists and the nurses that attended about pressure relieving equipment.
Yeah.
I think that just highlights how we work, you know, as an MDT approach.
Absolutely.
How a lot of our, you know, all our occupations cross over and how we work together.
Yeah, a really supportive feel to it, that, you know, we're all looking after one another. And
I'm very passionate to provide those support for students. And it's being open with your student, having those conversations, getting to know what their learning needs are, and how you can drive students to excel is a really rewarding thing.
I found that I learnt a lot from my student,
Yeah.
and it showed me where my areas of learning need were.
What are you hoping to achieve next in your career?
Well, I'm actually really, really happy where I am at the moment.
I think you're in a similar situation to me, whereas I'm quite happy where I'm at now. I feel I moved up the ladder quite quickly, and now where I'm at, I'm happy where I'm at, because I feel at this role I can make a difference, not just for the patients but for the staff that I work with, in terms of looking at them progressing. And
for career aspirations, I mean, I've always been one to progress as much as I can, but where I am now, I've still got my clinical role. I love that patient contact. That's so important to me.
Well, they support us a lot, and I really value that.
Yeah. They are such an asset to the team, aren't they? And you know, for some of them, they've been doing the job a long time, and actually their knowledge and skills they have, you know, could surpass any band 5 that come newly band 5 in the team. And sometimes they know the patient probably better than you do.
We're also getting experience on the job at the same time. Yeah. So if you go down that route, I feel it makes you a more rounded practitioner.
Yeah. It's like you say, you're in the role, you're kind of doing very similar work, although albeit not qualified, but you are doing very similar work that helps you then really put that theory into practice. Definitely. It's where you really learn the most, I feel, when you're on your placements.
Yeah. It's getting that experience opportunities. So if someone did want to, you know, just shadow, you know, there's routes there, there's access for them to come and shadow, and for clinicians to support.